Keisha. I hope everybody's well. We're going to go ahead and get started. Amanda, you can start the recording. That'd be great.
Yep, got it rolling.
So great, thank you. So thanks for being on the phone today, everyone. It's been a couple months since we spoke, so I hope everybody is doing well and enjoying the warmer weather that's been upon us for those of you on the East Coast, and any of you who've been affected by some of the weather recently. I hope that everything is okay in your communities. We're going to begin as we normally start with some updates from the CDC, so I'll turn it over to Tom, who's on the line.
Welcome everybody, and I just have a couple of sort of announcements, but also perhaps a request. And one is I'm hoping that during open mic that the folks that are part of the sprint training can give maybe a 1 minute or less description of what they're doing and what progress they're making. The other is we've had a very good call with the rural working group, and they're going to be talking to each other a bit more about some of their methodologies and goals. And Amanda is making that schedule, and anybody that would be interested in hearing more about what they're doing are welcome to call in. And then finally, sort of as an obligation of people in my branch, we have to mention Active People, Healthy Nation at least once a day. So I'll repeat that now and remind people it's our national effort to what we call level up 27 million people by 2027. And it's both CDC and all our other partners engaged in this. The current focus for us is around the built environment, and our grantees are tasked with doing what we're calling routes to destinations, which is the built environment recommendation from the community guide. Soon will be also what we call layering on more interventions, most of those coming from the community guide, ones that they've already looked at. And my request to you is if you have recommendations for other strategies that either aren't included in the community guide yet or hopefully will be in the future, let us know about those and we'll consider them as part of the so-called layering up effort. That's it.
Great, thank you, Tom. And as far as your first comment on Sprint and updates, hopefully Stephanie or Karen will provide a comment during open mic, and I see Renee is on, and maybe Renee, if you're interested in giving a minute update on our team, we can talk a little bit more about Sprint during open mic. So just a heads up to those people. So again, thanks, Tom. So let me shift to coordinating center updates briefly, and Amanda, I will also see if you have anything to add to what I'm going to say. Just a couple of brief updates. First, I think everybody is aware that our current grant in support of PAPRN Plus will be ending at the end of September, which means we have just 2 more calls. And so we're looking for volunteers for the July call. If anybody would like to use this opportunity to share with this network any work you're doing in policy, practice, research. And we've been thinking about using the September call as a way to have some updates from our work groups on things that they've been doing, any plans that they have to continue to do work in the future. And so we will be in touch with those leaders, hoping that they would be willing to provide some updates. And also, we'd also like to hear from the collaborating centers as well. So again, we'll be in touch soon with those individuals to see if you want to use or take advantage of that time in our September call to provide some updates to the rest of the network and plans for moving forward if you're going to continue to work together. And hopefully by then the information is released from the CDC about the sort of the future of PAPRN Plus, and I hope we can leave some time on that call to hear about what will be happening moving forward. So that's sort of the main update from the coordinating center. Let me see if Amanda has anything else that I forgot to mention before we turn it over to Russ.
Sure. I think just the other thing that we'll obviously be doing is wanting to gather and collect all of the dissemination and resources that the network has produced. And so we'll hopefully, we have the spreadsheet that we've been using, and people have been doing a good job of keeping that up to date. But I'm sure there are things out there that we've been doing that we haven't tracked very well. So we'll just be reaching out and asking all of you to contribute to that for our reporting. And also I'll be in touch. I know the work groups have been continuing to do some subgroup committee things. And so, but I'll be looping back with all of the leaders to, kind of reconvene and finalize all of the dissemination and work that we've been doing, and talk a little bit about moving forward and how to kind of keep the groups going in some way.
Great. Thank you so much, Amanda. And that's a great reminder about that link. I'll be sure to add that when we send the notes out from this call to anybody to just take a look at it and make sure that you have any documents or products or presentations that you've done. Again, this will be really important for us as we write the final report to share with the CDC after our funding period ends. So let me switch and get to our presenter today, who I'm just thrilled to introduce. And then after, we'll have time for questions and comments and make time for open mic. I have had the honor and privilege of getting a chance to work with Dr. Russ Pate over the last year on this new committee, on this NASEM committee and report that was just released, which is what Russ agreed to speak with us today about. So let me just briefly introduce him to you. Dr. Russell Pate is a professor of exercise science at the Norman J. Arnold School of Public Health at the University of South Carolina. Dr. Pate's research interests and expertise focus on physical activity measurement, determinants, and promotion in child and youth. He is involved in the PRC at the University of South Carolina, and he has a number of accolades. And I'll just highlight that he is the past president of both the American College of Sports Medicine and the National Coalition on Promoting Physical Activity. He's a member of the National Academy of Sciences, Engineering, and Medicine, as Standing Committee on Childhood Obesity Prevention, and the Roundtable on Obesity Solutions, and a number of other initiatives. And Russ was the chair of this new committee, this new report that was just released on Tuesday. So we're excited to hear a summary from him about the work that has that the committee worked together over the last year, and he'll share with us some of the highlights. And so let me turn it over to Russ. And again, thank you so much for making time to be with us today.
Well, Keisha, thank you so much. It was an honor and pleasure to work with you on the project. And I'll say by way of introduction that having been associated with our prevention center here at the University of South Carolina for a long time, I'm a longstanding admirer of the PAPRN network and the work that it does. And I really am excited and pleased to have the opportunity to speak with this group. And as Keisha mentioned, the timing couldn't be better. The report that I'm going to be overviewing was just released in the last few days, and so this is pretty much right off the presses. The project that I'll be overviewing is the title is right here. It's implementing strategies to enhance public health surveillance of physical activity in the U.S. And you know, as I launch into this, I'll say that you could probably read that title in various ways. One thing that I hope to emphasize here is that this particular project and the report that it generated was anything but a 30,000-foot overview of issues related to surveillance of physical activity. This, as you'll see, was the opposite. It was very much down in the weeds, and that was by design, and a result of this report building on a couple of earlier projects that I'll be saying something about here. So thanks for having me in, and it's an honor to be here. So as I'm sure most of you know, the National Academy's reports are undertaken with support from a sponsoring entity, or sometimes more than one. And in this case, the sponsoring group was the Division of Nutrition, Physical Activity, and Obesity in the Chronic Disease Center at CDC. So the folks that are also represented on the call here today were certainly instrumental in generating the support that made it possible to undertake this project. Public health surveillance, as this group knows, is the ongoing systematic collection, analysis, and interpretation of outcome-specific data for use in the planning, implementation, and evaluation of public health practice. And the key pieces there are that this is to be systematic and ongoing, and that it's applied in the planning and implementation process. And I think this particular project really emphasized the end use of information that's generated through the surveillance process, and I'll have more to say about that in a bit. Also, this group certainly appreciates the complexity of physical activity behavior. It's a behavior that, as we know, occurs in many different forms at different intensity levels, in lots and lots of different settings, and for many different reasons. And people's participation in physical activity, as we've learned, is influenced by many factors, some that are, person level, some that are social, some that are institutional and community-based, or even those that operate at the societal or policy level. So because the behavior is complex, monitoring that behavior through the surveillance process is also a complex and multi-component process. Lots of good reasons why it's important for us to do this, though, even though it's complicated, and as extensively documented in the recently released Physical Activity Guidelines Advisory Committee report, and then ultimately the guidelines themselves. We know they're compelling health reasons why we need to figure out how to promote physical activity at the population level in the U.S. And central to that is understanding, the behavior, who's participating in it, and the factors that associate or influence it as extensively as we can. And of course, this group fully appreciates, particularly in adults, but in kids as well, the documented health outcomes associated with higher levels of participation in physical activity, only gets longer, almost on a monthly basis. So the background is that our field, and this probably will drift off for a moment into kind of personal editorial territory, but I think the evidence documenting the public health significance of physical activity is enormous. And nonetheless, I think our field being sort of physical activity in public health, it remains in some ways the new kid on the block in the public health arena. And I think we've got a continuing effort here to build the infrastructure that it'll take for us ultimately to be successful in increasing the physical activity level of the population in the U.S. So the project that I'm overviewing today did not drop out of the sky. It was very much the next step in a process that's been underway for some time. An initial step was led by the folks at a physical activity branch at CDC, Janet Fulton and Susan Carlson, led an effort that was organized as a collaboration between CDC and the American College of Sports Medicine, brought together a group of people to evaluate where we are with physical activity surveillance in the U.S. and begin the process of laying out a strategic plan for addressing the gaps. And so that project developed strategic priorities that would sort of guide this developmental process, and they included identifying and prioritizing physical activity constructs, assessing the psychometric properties of instruments that could be used, providing training and technical assistance to support the process, exploring accessing data from sources that may not have heretofore been drawn into this effort, and improving communication, translation, and dissemination about estimates of physical activity from surveillance systems. So that then led to a follow-up project that was undertaken under the auspices of the Physical Activity and Health Innovation Collaborative, which is associated with an entity called the Roundtable on Obesity Solutions that is based at the National Academies of Sciences, Engineering, and Medicine. And that project involved bringing together a group of people to identify actions that could be taken to improve physical activity surveillance. And this group convened in 2017. It was co-sponsored by American Heart, ACSM, CDC, NIH, and the National Physical Activity Plan Alliance, and 42 experts came together for a two-day meeting to move this forward. The product is a document. Kind of the title is shown here, and it was released in September of 2018 and is available for everyone to overview. It essentially identified high priority strategies for building a more robust physical activity surveillance system that was organized around four areas, and I'll identify those here in just a moment. That all led to the project that I'm reporting on today, and it's entitled here. And you know, the National Academy's reports, as you know, are produced by a committee that is impaneled for the purpose of addressing a task. And this is the 7-person committee that was brought together to take on this project. And you can read the list. Keisha was a member and great contributor to this process. And we had a wonderful group. And I'll have to say that this all operated on a pretty tight timeline, and the folks listed here, really did have to step up and get the work done in a pretty efficient and timely manner. And it's a great group to work with on this project. So before the committee is put together, a statement of task is laid out, and the committee is assigned the work of addressing that task. And this is the task statement that was established for this project, and said that the committee will be convened to develop strategies to support implementation, and that the group would examine and build on existing recommendations in 4 areas. And the 4 are children and youth, community supports for active transport, healthcare, and workplaces. And so the work was organized around those 4 sectors or topical areas. And then, of course, the job is prepare a report to summarize the findings and conclusions. And so a key element in this project was an in-person meeting that brought together about 30 people who had brought expertise in issues related to physical activity surveillance in the 4 designated areas, and many of them, I'll have to say, crossed areas and brought expertise that really did enable us to produce this this product in an integrated manner. But the work certainly was organized around these four topical areas. So a number of criteria were applied in prioritizing the strategies that we were going to focus on in this project. And one was feasibility. We wanted to, this was not intended to be something that might identify actions that could play out over the next 20 years or something. The intent really was to make recommendations that would be seen as feasible and the kind of thing that could happen in the next 2, 3, 4 years. Impact, we had to limit the scope of the work in some ways, and so one way to do it was to try to focus ourselves on actions that we thought would be as impactful as possible. And in discussing the recommendations, we did ask the group that was there in person for the consultant meeting to consider the following factors. Is instrument development work needed to move forward in this area? Could an existing surveillance system be modified? Which organizational actor or actors could implement the strategy? What financial and human resources are needed to implement the strategy? And will it be necessary to mount an advocacy effort in order to implement the strategy? So hopefully you can see that this was not a high-level overview. It was intended to be right down in the trenches, trying to figure out what it would take to actually get some important enhancements in place. As the group did its work, there were some overarching principles that we endeavored to adhere to. One was equity and inclusivity. I know this group appreciates that we're probably not going to make much progress in increasing the physical activity level of the U.S. population if we're not successful in kind of moving the dial in subgroups of the population right across the board. And so, we very much wanted to make recommendations that would ultimately contribute to equity and would play out in an inclusive manner. Noting that physical activity is a complex behavior and is influenced by factors that operate at a range of levels. We want to make sure that we're putting forward recommendations that were consistent with that reality. Another guiding principle was that participation from a diverse set of key partners was probably going to be necessary to be successful here. And so we tried to keep in mind that it was going to be necessary to draw into this effort groups and individuals and expertise from a wide range of sectors and organizational settings. In addition, the recommendations that we ultimately settled on were intended to be implemented in a manner that's legal and ethical. We're aware that when you start collecting what could be sensitive information from people, that you've got to be very careful about what you do with that information and how you protect confidentiality. And with all the devices that are now available, this issue is probably even more sensitive than maybe it's traditionally been. Another guidance point was expanding the availability of physical activity information at the state, tribal, and local levels. And that was true even though our focus was at the national level. We understand that a lot of important surveillance work happens at other levels. We wanted to show an awareness that there are needs and opportunities to enhance physical activity, surveillance, in other areas. We had to limit the work to the 4 areas that we were, called upon to address in the task statement. But, we certainly recognize that there are other areas where there's a need for enhancement as well. It's very much a moving, rapidly developing, set of resources that are available in this area these days. And, it's a challenge to sort of stay ahead of the curve with new technology and so on, but we wanted to try to, be as forward-looking as we could. And we wanted to address surveillance of participation in all forms of physical activity. I think sometimes there's probably a tendency to focus, pretty much exclusively on, whole body aerobic type activity, but we wanted to make sure that we included recommendations that would apply to resistance exercise and bone loading activity and so on. And again, to emphasize that we wanted the recommendations to be feasible for implementation in the near term, not something that was going to take decades to play out. And though the focus was very much on surveillance and enhancing our surveillance system, we also are very hopeful that the recommendations we've made will help create a system that will ultimately be a boon to physical activity public health research as well. So the recommended strategies are sort of summarized here. Across the whole report, there were 22 strategies, and those strategies were largely overlapping with the strategies that were recommended in the preceding project. There was some tweaking of those, but the new work here was really not at the strategy level. We did ultimately address 6 for children, 6 for healthcare, 4 for workplaces, and 6 for community supports for physical activity. The new work here was largely at the implementation action step, and there are 59 actions in the report recommended for across the strategies identified above, and total of around between, as you can see, 12 and 16 implementation actions across the 4 areas addressed in the report. So the report's very detailed. I recommend it to you for review, and I can't presume to cover the whole thing. So what I thought I would do, just to give you a taste of the content of the report, is just pick the first strategy from each of the 4 content areas, point out the strategy, and then the supporting actions that the committee identified as important ways to move forward with the strategy. So for kids, the first strategy read develop and implement state and national level systems for monitoring physical activity policies and practices in early child care and early childhood education settings. And the 3 supporting actions were as follows. One, and maybe I should preface this by saying there are a lot of CDC's should in this report, and the reasoning there is probably obvious that a lot of our surveillance in this area is currently managed by CDC, and if we're going to have a system, clearly CDC will have to help with that. So I don't think there's anything surprising about the fact that you see that phrase a lot here, but it is prominent in the report. So the first action here was the CDC should implement a system for monitoring existing state-level policies for the promotion of physical activity in child care settings. Now, we weren't doing this work in a vacuum. I mean, we knew that CDC has been working on such a system and has piloted it. And so, in a sense, part of what we did in this work is, hopefully give an endorsement to things that are already underway. And in some cases, that it was, got to start from scratch. But in this case, we know that there's work. Comprehensive surveillance system that monitors both pertinent state regulations and setting level practices in the state. So that's both state regulations and setting level practices. And then the third is CDC should implement a national system for monitoring and implementation of physical activity practices in the child care center level. The second area that we worked in was healthcare, and a strategy there was develop surveillance systems to monitor the prevalence of physical activity assessment in adults through expanded integration of a standard physical activity vital sign in healthcare delivery. I think many here are well aware of the ongoing exercises of medicine effort that's in a collaboration of ACSM and the AMA over time. And so the first action is an expert panel, including representatives from a number of organizations, should develop standards for documentation of physical activity vital sign and electronic health records. Second is an expert panel, including representatives from multiple organizations, should develop a survey to monitor healthcare systems use and integration of physical activity vital sign into electronic health records. And third, an expert panel, including representatives from multiple organizations, which should work to reduce and equalize measurement error incurred from a standard patient physical activity vital sign administered by self-report. So you get a sense of the level of detail that these and specificity that are there in the action steps. To move on, for workplaces, a strategy was document existing surveillance efforts that capture physical activity, fitness, sedentary behavior in workplace and in employees' commutes to and from work, and identify opportunities to expand those efforts. And again, there's a call for groups to come together to conduct a comprehensive analysis of what's out there. Next, CDC should convene an expert advisory group, from including representation from the business and industry sector to identify gaps. An expert group should develop questions based on the gap analysis. Advisory group working with CDC should assess processes and costs involved, and then ultimately identify potential funders, both from public and private sources to support expansion of surveillance system in this area. So the details, the steps are laid out in considerable detail here in this report. And finally, for the community supports for physical activity, a strategy included there is prioritize a set of constructs and corresponding survey items to assess perception of community supports for active transportation and active recreation, and incorporate the constructs and survey items into national surveillance systems and promote their use at the local level. And again, there are very specific actions recommended. CDC should convene an expert consensus group, should communicate the prioritized survey items to national and local public health agencies, should convene a broad intra-agency group to explore providing geographic identifiers, and should recommend changes in research data center practices to facilitate wider access to geocoded NHIS survey data. So it's all there in excruciating detail in the report, which is available at that URL at the National Academy's website. At that point, I'm gonna stop and see if there are questions and discussion. I'll certainly invite Keisha to join in the discussion here and provide additional comment or detail as appropriate. So again, I appreciate the opportunity to speak with everybody today, and thanks for your attention.
Great. Thank you so much, Russ. That was a really terrific overview of a very detailed report. I will monitor the chat box, but want to open it up to questions and comments from anybody. And I know I've been telling people to mute your line, so let me encourage you to unmute your line when you have a question.
So Keisha,
maybe
Holly,
while we're waiting, go ahead.
Sorry, go ahead, Russ.
Okay.
I was just going to point out that Holly just put a question in the chat box whenever you're ready.
Oh, okay, great. Sorry, I must have a delay because I don't see it. Did you want to just go ahead and read it?
Russ, hi everyone. David Berrigan here, NCI.
Hey, David.
Unfairly asking questions since I'm somewhat familiar with this report. And Russ, could you talk more about the conversation that ensued about how to further make this happen? Because it sort of feels like it's, okay, now we have some really good recommendations and, you know, people can read them and just make them happen. But what are some of the strategies that could be used to lobby, encourage, pressure, you know, accelerate a move towards some of these strategies?
Yep. Thank you, David.
Sure.
Well, you know, a thought that's arisen more than once as we've gone through this process is, you know, what's it going to take to, you know, to take all these action steps? And you know, I guess I personally put them in 3 buckets. You know, I think there are a lot of the action steps here that really do not require, you know, tremendous resources that, you know, I don't know whether it's fair to call them low-hanging fruit or not, but I think there are a good many of these action steps that, you know, if an interested party wanted to get it done, you know, it would not be that costly to do it. I think there's some in kind of in the middle bucket where some resources would be required, but not, you know, not enormous resources. And, you know, if, you know, either an agency or a not-for-profit organization, for-profit organization, you know, was motivated to take the step that, you know, the resources would not be overwhelming to do that. And frankly, there's some recommendations here that would require resources and probably would necessitate advocating with policymakers, you know, to get this done. And, you know, I think that's where the, you know, the nonprofit health organizations and collaborative groups and coalitions that exist, you know, would need to, you know, would need to step up. You know, because I've been involved in the National Physical Activity Plan Alliance for a long time, you know, I will point out that one of the overarching strategies in the current plan, you know, is, you know, it does call for building, you know, a more robust physical activity surveillance system. So, you know, hopefully the, you know, the organizations that, you know, that do routinely advocate for physical activity initiatives would you know, and would take on some of these that you know, will require resources. But you know, I don't think there's a wave a magic wand approach to it. You know, I think it's going to take getting down in the trenches and pushing to identify the resources needed to do some of these things.
Super.
And this is Amanda. I'll go ahead and read Holly's question. So she's wondering if there is a plan for who to include into the healthcare panel. And just a follow-up comment, she said, I think to make sure rural and underserved populations are included, primary care needs to be on the panel in addition to the specialists at the Heart Association and Exercises Medicine. So just a little bit more about the healthcare panel.
Yeah. Well, I'll have to say, even though this report, and Keisha may want to add to this, so I'll invite that here as I'm providing my response. But you know, even though there's a lot of detail in the report that probably would take it to a level that we didn't quite get to. You know, a lot of the action steps recommended in the report name organizational partners that you know, the group felt should participate or could participate in getting certain tasks taken on. We didn't quite go to the level of, you know, naming personal names or, you know, trying to form some of these groups. I think the assumption was that, you know, our job was to lay out the roadmap and you know, very much hope that you know, that the recommendations will be taken seriously and groups will, you know, kind of take the baton and run with these things.
And Russ, this is Keisha. I don't have much to add except to say, I was just going to quickly add, Holly, thanks for that question. And I think you'll see when you review the report, as Russ said, there's room to really identify the various stakeholders And I suspect when you look at the specific recommendations, you'll see that there's calls for specialists, for other stakeholders within the healthcare system, and you'll see that in various sections of the report.
You know, I think many of you know this, but you know, the National Academies has a you know, a very prescribed process, you know, for how these reports are generated. And you know, I'll have to say, in this case, you know, frankly, I was a little bit surprised that we were encouraged to be as specific as we were encouraged to be in terms of naming organizations that we thought should, you know, help get these things done. But there really was no reluctance at any step in the process to, well, not name personal names, but to name organizations that we thought were in a position to take some of these actions. So, you know, and we didn't, you know, we didn't request permission. You know, it was all based on, you know, the committee's sense of which organizations could contribute, and on the basis of input that we received from the consultant group that came together.
Hi, great question.
Great.
Yeah, thanks so much for the presentation, and the report looks incredible. Really happy to see it here, and looking forward to look through it a little bit more. And one of the things I thought was great is how you're starting surveillance at the very young age at daycare centers, and I'm wondering if that's followed through the life course, if you're looking at methods of surveillance with older adults and all including institutionalized adults on that end of the lifespan, especially since physical activity is so protective of some of the NCDs and dementia.
Yeah, well, yeah, you remember our sort of our caveat that we weren't doing everything, and I think that's the children and youth were identified as an area where there was a particular need and probably opportunity. And I think since I work in the field, I think now is a particularly good time to be trying to get some things done that would apply in the childcare setting, because a great many states are developing for the first time policies in this area. So I think that was part of it. But I think aside from actions that might fall in the other three areas, that would clearly apply to to older persons, healthcare, in some cases work sites or community supports, we didn't target that segment of the population, and so there certainly is more work to do here.
Of course. Thanks.
Russ and Mrs. Keisha, just want to highlight or call out Christian's comment about appreciating action 18.4 to explore options that would address surveillance in rural, small towns, and tribal nations. And so I don't know if you want to take the inclusion of that, but I just wanted to acknowledge Christian's comment.
Well, another, to give credit where credit's due, doing this, with the support of, just the great staff at the National Academies. Heather Cook was our primary staff leader on this project, but the full set of resources available at the National Academies are brought to bear on these reports. And once the report is drafted, it goes through an external review process and a very rigorous internal editorial process, and it makes these reports better, and then some issues like that get caught in the review editorial process. So hopefully, the fact that this is coming from the National Academies will enhance the effectiveness of the recommendations ultimately, and certainly makes it a better report, I think.
Great, thanks, Russ. Other questions or comments for Russ? There's a question in the chat box. It says, with respect to diversity and inclusion, has the committee identified potential partners from Native American communities?
We didn't take it to that level, but I mean, it's you know, I hope that the language throughout the report makes clear that that you know, that sort of thing needs to happen as this process moves forward. You know, again, I guess to personally editorialize, I mean, I think one of the most important ways for us to enhance the surveillance system that we have for physical activity is, you know, is to make sure that the data that we collect and summarize and report out really does apply at a granular level across the country. And you know, I think we all know that's one of the real challenges here. You know, it's one thing to, you know, draw what might be a fairly modest yet nationally representative sample, and it's something else again to, you know, to have the data collected and ultimately summarized and reported out in a way that, you know, really does apply well at you know, in communities across the country. And so I hope that's one thing that ultimately results from some of the recommendations in this report.
Great, thanks, Russ.
Keisha,
Any other
Jamie.
questions? Oh, great. Hey, Jamie.
Hi, Russ, thanks very much. I just want to say on behalf of everyone who were participants that I think you guys did a fantastic job synthesizing all the inputs you got. I think given the constraints of what you were facing, I think it came together really nicely. So thank you. And thanks to you, Keisha.
Well, thank you. Appreciate that.
Yeah, thanks, Jamie. Okay.
I've got to give credit to Heather and the others at the academies that managed this process, because the timeline was challenging, I got to say, and you know, I think you know, the committee members, you know, certainly committed to the process, but we could not have done it if it weren't for Heather and her colleagues at the academies supporting this, you know, this whole project.
Great, Russ, and this is Keisha. Maybe before we wrap up this part of our call, would you like to provide any comments on ways that this report is being disseminated to make sure that people in the field are able to access it and are made aware of it?
Yeah, a lot of organizations have been drawn into the dissemination process, and I hope you're beginning to see it out through the various channels. I'm not sure if Heather's on the line or not, but it probably she or one of her colleagues from the academies would be best able to summarize the various ways in which this is being disseminated. But you know, a great many of the organizations that were represented in this process itself, I know, are disseminating the report through their organizational communication channels, and I think that's going to be the primary avenue for getting the report out.
All right, great. Thank you so much, Russ. I want to just thank you again for making time today. When we send out the notes, we'll certainly send a link to the report in case you haven't seen it. We'll share the link that's here on the screen, and just ask that you take a look at it and contact any of us who were involved. Go to Russ as the chair first. No, I'm just kidding. You come to any of us if you have questions on the report. And again, please. I want to just thank Russ and thank the rest of the committee and the CDC for sponsoring this work. I think it's critical for the field, and look forward to continuing to talk about it and to share the work. So thank you again, Russ, for making time to be with us today.
Thank you very much.
All right. So we just have a few minutes left, and it's time for open mic. I know that I just want to make a plug for the email that the coordinating center sends out that has announcements about abstracts that are due, other opportunities. I ask that you please take a look at that if you're interested. I want to give the people on the phone who are involved in the Sprint program an opportunity to just briefly mention what that is, since Tom asked. So maybe if Renee or Stephanie or Karen would like to just say briefly what that is and what we're doing, that'd be great.
Sure, this is Stephanie. I can go ahead. So our two PAPRN related projects have been selected to participate in the Sprint program, which is being sponsored by the National Cancer Institute. The Sprint program, in a very high level sense, is really a program for researchers to learn and utilize really principles, practices, and methods related to entrepreneurship to bring their research products into practice in some way, shape, or form. It's a really intensive 7-week program that involves in-person training for, I guess, 2.5 days in Washington, D.C., followed by a 7-week curriculum and a summative visit back in the D.C. area at the end of June. A big part of the program is doing a series of 40 interviews over this time period to try to nail down and figure out how to best sort of take what we're doing and institutionalize it or implement it in some way, shape, or form. All of the folks who are participating in this particular program are, I think that our projects, the Baylor/Hopkins project and the UMass projects are a little different in that we're a little more public health focused. A lot of them are more behavioral intervention focused, but all sort of in the space of prevention and disease management overall. It's been a really fun, I think, experience so far, but as I said, very time intensive, and we're really learning a lot.
Great, thanks, Stephanie. Yeah, Renee or Karen, have anything to add? Or?
Well, that was a great summary, Stephanie. But yeah, it's been a lot of fun, and our building off of the Play Streets work that Keisha and I've been doing, we're learning a lot about the broader sense of how we fit and how to think about customer segments, and it is definitely intense.
Great, thank you. And I'll just say the Sprint program ends at the end of June, and then I think, again, I think the hope is that we are all better equipped to think about customer discovery as part of dissemination efforts as we move forward with our research and our work, and as we continue to disseminate this work. So maybe we'll provide another update at the next call just about what happened, since the program will have ended by then. So thank you for that. Are there any other comments or updates anybody wants to make right now before we wrap up? We have a couple minutes left.
So I just Janet wrote in the text box. She said, I don't know if David Berrigan talked about the conference on health and active transportation, but she'd like to give an update. So Janet, are you able to unmute yourself, and you want to give us a quick update? Or David?
This is David Berrigan. If Janet can't, is Janet there?
Maybe if you can go ahead and give us an update, David.
Yeah, so you mean the Conference on Health and Active Transportation that is being organized by TRB, ACSM, NCI, and CDC?
I believe that's what she's talking about. She didn't mention.
Yeah, just wanted to make sure we're talking about the same thing. So at the Transportation Research Board annual meeting in January, we had a conversation in the Arterials and Public Health Task Force where a number of people suggested that it might be useful to revisit a 2016 conference on the theme of health and active transportation, since several years have passed, and we want to try to continue some of the amazing momentum of the public health sector, the transportation sector, and diverse stakeholders all across the country by having another conference. So there's a call for abstracts, which I will send to this group. The meeting is going to be held here in Washington, D.C., December 11th and 12th of this year, 2019. And the conference is going to have poster sessions, and then a variety of panels, breakout groups, and plenary speakers who will be invited. And the themes really are building strategic institutional relationships. So we want to accelerate connections between the different players in this complex landscape of health and transportation. Identifying research needs and opportunities. So while there's a growing amount of research in this area, there's still a lot of unknowns. For example, the arterials and health task force at the Transportation Research Board identified 250 research challenges related to arterial roadways and health. And then the third theme is, reflecting and exploring innovative practices. We think a lot of important new things are being implemented that have a lot of basis, but haven't been, shared widely enough all across the health and transportation sector. So, like I said, I'll send a link to the registration. We'd love to see as many people as possible, because we think it'll be a really lively follow-up to the 2015-2016 meeting. Does that make sense?
Yeah. Thank you, David. That was terrific. And Janet sent the link in the chat box, so we will make sure to include it. We'll include it in the notes. And we had already included it too in this week's Plus call, but we'll be sure to continue to include it in the future correspondence. We also
I hope to see many of the people who are on this call at that meeting.
Yeah, we hope to be there.
And we're still working. We haven't yet established the agenda of speakers and panels. So we wanted to get the call for abstracts out to get people assigned, but the steering committee, it's complicated organizing a meeting with people from a lot of different sectors. And I'm sure many of you on this call are experienced with that. We all have somewhat different ideas of what a conference should look like. So we're working together patiently, but it's taking a little longer than sometimes like a pure health meeting seems to take.
Definitely understand. Well, thank you, David, and we will get that out, and appreciate the update. And so I'm mindful of the time. It looks like we are right at 2 o'clock, and so I want to thank all of you again for being on today. Thanks to Russ for a great presentation. We will get these resources out to you all, including the link to the recording for today's network call. Again, if you're interested in presenting at our next call, it's July 25th at 1 p.m. Eastern Time, so send us a note. And have a great rest of your day. Thanks so much.
Bye, all.
Thanks, everyone.
Bye.